Breastfeeding growth spurts can feel confusing and exhausting, especially for new parents. One day your baby seems settled, and the next day they want to nurse non-stop. If this sounds familiar, you're not doing anything wrong. What you're experiencing is a normal and healthy part of your baby's development. A growth spurt is a short period when a baby grows rapidly, both physically and developmentally. During this time, babies breastfeed more often to increase milk supply and meet their growing nutritional needs. Breast milk works on a supply and demand system, so frequent nursing helps your body produce more milk. Common growth spurts usually happen around 2 to 3 weeks, 6 weeks, 3 months, 4 months, and again around 6 months. However, every baby is different, and growth spurts don't follow an exact schedule. Some babies may have more frequent spurts, while others may have fewer. One of the biggest signs of a growth spurt is increased feeding frequency. Your baby may want to nurse every hour or cluster feed for several hours, especially in the evening. They may also seem fussier, cry more, and have trouble settling between feeds. This behavior can make parents worry about low milk supply, but in most cases, milk supply is not the problem. During a growth spurt, your baby may also have shorter or longer feeding sessions. Some babies feed quickly but very often, while others stay latched for a long time. Night wakings may increase too, as babies often nurse more during the night to boost milk production. For mothers, growth spurts can feel physically and emotionally draining. You may feel tired, touched out, or worry that your baby is not getting enough milk. It's important to remember that frequent feeding is your baby's way of increasing your milk supply naturally. As long as your baby has enough wet diapers, is alert at times, and continues to gain weight, breastfeeding is going well. To cope with growth spurts, try to rest whenever possible and stay well hydrated. Eat nourishing foods and trust your body. Avoid supplementing with formula unless medically advised, as this can interfere with milk supply. Skin-to-skin contact and feeding on demand can help both you and your baby through this phase. Growth spurts usually last 2 to 3 days, though some may last up to a week. Once the spurt passes, feeding patterns often return to normal, and many parents notice their baby looks longer, chubbier, or more alert. Understanding breastfeeding growth spurts can ease anxiety and help you feel more confident. These intense feeding days are temporary, and they play an important role in your baby's healthy growth and development. Trust your baby, trust your body, and remember, you're doing an amazing job.